Welcome to the Permian Basin Petroleum Association OTA Compression and OTA Environmental webinar. My name is Grant Swartzwelder, President of OTA Compression, OTA Environmental. As most of you know, we've been doing these webinars as trying to help the industry understand different issues, whether it's environmental or PPP or bankruptcy issues, and have had a good response, and so much so that we've opted to continue to do them. But what's really nice is that we now have a co-sponsor in the Permian Basin Petroleum Association, because so much of what we do is out in that area, and obviously so many oil industry participants are out there. So I'm pleased to introduce Stephen Robertson, who's Executive Vice President of the PBPA. He is going to be moderating this, and so I know it's sad for everyone, but I'm going to be exiting and letting Stephen take it from here. But thanks for everyone that's attending, and I think you'll find this presentation very informative. Stephen, my best to you.
Thank you, Grant. And since we're a few minutes behind where we would like to be, I'm going to do quick introductions, but just so that anybody that doesn't know out there, PBPA is an advocacy group that tries to do whatever we can to help the oil and gas industry of the Permian Basin in both Texas and New Mexico. We largely have legislative and regulatory efforts in Austin and Santa Fe, but we also do a lot of membership activities and try to put on events that benefit our members in a number of ways. While probably the majority of our membership come from E&P companies, we also have a very substantial segment of our membership that comes from the service industry, as well as members in the midstream industry and other aspects of support for the oil and gas industry of the Permian Basin. Today, we wanted to talk about an issue that has been impacting everybody, but not specifically just COVID-19, but how people are getting back to work in the world of COVID-19, and with CDC recommendations on there on how to do that. We've got two gentlemen that are going to talk about those issues today, one from the service side and one from the E&P side. We'll see if folks are approaching things a little bit differently. We'll see if they have some specific issues that have popped up for them that they've had to focus on, and try to give everybody just a good idea of what some options are in getting people back to work, what some options are in trying to keep your people healthy and safe as you are getting back to work. On this webinar panel with me is Wesley Fowler, who is the Environmental, Industrial Hygiene, Occupational Health Manager for Cudd Energy Services. His experience in environmental health includes working in the public sector through the U.S. Public Health Service Commission Corps, the U.S. Army Public Health Command, the U.S. Navy, and NASA, and Paul Peacock, who is the Health, Environment, Safety, and Regulatory Director for Callon Petroleum. He has extensive experience and background in HSE and regulatory compliance programs in the oil and gas industry, going back more years than he might care to share. PBPA has been focused on HSE issues for a very long time. We've been around since 1961 and have focused on those issues both on the ground in the Permian Basin and in the state houses in Austin and Santa Fe, and even up in Washington, D.C. We have a HSE committee that tackles these issues and talks about them on a monthly basis. The committee also has put together a benchmarking study to go over spills and safety incidences to try to improve companies' operations in the industry. We actually just completed that survey of our membership about a month or so ago, and it didn't have anything in it having to do with COVID-19 and response. That might be something that we have to include going forward to try to help folks. But that's really what we want to focus on today. So thank you for joining us today, and we'll get right to the matter at hand. And Wesley, I'm going to start with you. Most of all my questions are very open to both of you, but to try to just get us started, I'm going to put you on the hot seat first. Just kind of in general, as companies are trying to get back to work, trying to transition from folks staying at home, or transition from the workers that were out in the field, maybe not being as many to now increasing, what kind of changes in policies and procedures have you guys had to put in place? Maybe where have you gotten recommendations on that to try to help promote the health and safety of your employees while still trying to navigate the recommendations coming from the CDC and from the state governments?
Yeah, so that's a good Good question, Stephen, and really covers a wide range of topics here. And I think our company, probably like many of yours, falls underneath the Department of Homeland Security's essential businesses. So we have been operating since the beginning of this, like I said, as most of you probably have as well. So we've been in various phases of return to work since this thing started. And I think the first thing to realize, and that's important to take into consideration, is it really does take the entire company to return safely and to be able to continue working without transmitting the virus. And, and that goes from the CEO, the HSE group's heavily involved. We had issues on the IT networking side with folks from home. And probably most importantly, some of the custodians that are doing their business. And you need all those groups to successfully implement a response to a pandemic of this magnitude. COVID-19 is still a new virus. We don't know everything about it yet. We're still learning. But many of the controls and the policies and procedures that we're implementing really fall back to basic HSE premises. We use a hierarchy of controls, starting with engineering, some of those being, physical barriers, UV light treatment on our ventilation systems. We step into administrative controls with more of the social distancing or restricted access to some of our areas. And then, the PPE side where we've implemented, face masks and hand sanitizer and things like that. And what we have found to be successful is really a combination of each one of those. So when we implemented our policies and procedures, we took a multi-phased approach to that and implemented several of those, from procedures down to bulletins, site-specific action plans, and screening procedures that look at the operations of each facility and the work that they're doing in order to best control the virus. We realize and recognize that there's currently no silver bullet right now that's going to stop this pandemic. So our goal was to really cut that transmission chain. And essentially reducing that R naught value or measure of infection down to the lowest level possible in the workplace. Again, our general manager has been highly involved with this process as we've rolled out with it, and have really done a good job in helping us to push this out and really to be successful in this with this pandemic. One of the most important things when you start looking at processes and procedures is really education through those effective and clear communication channels. And that's something that is difficult, something that we've struggled with at times. A lot of times trying to keep up with rapid amount of information that's constantly being released and revised by these federal and state governments, as well as the 24/7 news coverage. That is constantly throwing things out there, and you'll read one headline stating that everyone should wear a mask going out in public, and then the next day they may walk that back. That's been something that's been pretty consistent, is the fact that it's constantly changing. When we moved on to some of our different procedures, first thing we wanted to do, again, to cut that transmission chain, was get everybody out of the office. We look at our business continuity plans, what is required to maintain our minimum operations. And we identified those areas, and then everybody else out of the office. We wanted those guys working from home. And some situations we might not have been able to get them fully from home, but we've instituted a worker rotation where people can come in, on certain days where there'll be less people in the office. But that's brought on its own really unique set of challenges. We're used to having a standard baseload of employees in our offices and facilities, and a similar set in the field using EP and access or other things to do their job. What we found out, this placed a pretty heavy load on our IT systems. And they had to jump in and get engaged and increase some of the licensing and increase some of those operations that was from that remote setting, and it really done a very good job at it.
Yeah,
I'm sorry, go ahead.
I was going to say, and that's an aspect that you know, so many people wouldn't have really thought about in the response. They're thinking about the health and safety side of things, but the increase in capital that needs to be plugged into things like IT so that people can work from abroad was something that everybody had to deal with. And so I'm glad you touched on that.
Absolutely. You know, so one of the other things that we implemented early on in this was screening procedures. So we partnered with an emergency response team, and we placed EMTs at each of our facilities as well as all of our remote work sites. This has probably been one of the most productive pieces, and probably one of the most important pieces to the screening tools. Is checking those temperatures and asking a few simple questions to those people coming on site. And trying to figure out if they've been traveling to hot spots or if they've been, you know, through an airport or things like that. One thing I'll note on that as well, it's important to realize that those temperature screenings are considered a medical exam under the EEOC and typically is prohibited. Since there's an official declared pandemic currently going on, those temperature checks are being allowed, but it is important to stay up to date on those releases and those laws and regulations, and working with your HR departments to ensure you don't get cross on some of the other areas. Another big piece to this as well is visual identification. So when people would come through the screening processes, we identified them visually with the fluorescent band. So those people that are out there working would be easily identifiable, and people who didn't have a wristband that may have snuck in the back door or another way could be asked to go back through.
Paul, Wesley's done a really good job of trying to lay out how they've approached things, how they've gone about things. Is there anything kind of different that you guys have done that you can throw out there? Anything that you've run into? And in particular, Wesley talked a little bit about some of the differences in the ways that they have, and it's not very many differences, but what they've had to do for folks in the field versus folks in the office. Anything different in y'all's shop on that side?
Yeah, no, good to join you this morning. I will say just a couple of things come to mind. One is we recognized early on that EHS and HR were not health professionals, and so we certainly recognized that we needed to leverage, find a health professionals that could help us through case management, if you will, because you know, potential exposures seem to be everywhere, and with differing degrees of separation, if you will. And so yeah, that we found that to be very successful. Is partnered up with, and we already had a partnership with a medical provider that was providing that helps us with injury case management as well. So we worked with them, put a protocol in place so that when we referred an employee, and in some cases contractors do it, then they were the ones making the determination if there need to be quarantining, self-isolating, or actually need to go in for testing. So that was very beneficial, not only to myself and my HR director, but also to our executive team, who's been certainly very engaged all the way from, you know, the initiating our business continuity plan and teams to really managing it at a very high level. It's been good from that standpoint. We certainly took action where we have large groups of employees in the field to set up screenings, both questionnaires as well as temperature screenings. We have not done that in our office environments. There was some specific protocols. We've had people coming back on rotations. We have a kind of an A schedule and B schedule every other week that allows employees to be in the office for no more than 4 days in a week. So there's 10 days, if you will, outside of that time period where they're isolated and still have all the protocols in place where there's no face-to-face meetings and those sorts of items. I could certainly go on and on. Anything else that comes to mind there?
Well, one of the things that you talked about, and you, Wesley, and I even talked about earlier on this morning, the degrees of separation between possible impact sites. How do you deal with that as a company when it's not just your employees that you're trying to shepherd through this process and make sure are staying safe and healthy and not being exposed, but they're going to have family members that could have jobs or could be out in the community and getting exposed to possible cases as well. So what can you do as an employer, as a company, in trying to protect your workforce when you don't even really have control over so many of the access points to your people?
Yeah, that's a good question. And that one of the things that we've done for our field folks, which was a little bit controversial or a little bit of a struggle at first, was to require face coverings. And we didn't issue it out as PPE. We weren't going down the COVID, the N95, type of mask. So it was more of, limiting that exposure. So we asked every employee that is in the field, if you can't have social distancing, then you're required to have the face coverings. But so that I can tell you, I can think of at least 3 instances where that is, we believe, minimized when they came into contact, with an individual that actually had contracted the virus. So, but as long as we had those mitigations in place, all of those employees that had that potential exposure went through our medical service provider, and then there was a decision made on whether there was further isolation or if there was any testing that needed to be done. So, man, I really shouldn't say this out loud, but we haven't had any exposures, and we think that, well, one, it's always good to be lucky, but the other thing is when you have our executive team has always put the employees over everything else, over our operations, production, work, everything. So if we can't do it safely, we're not going to do it at all. And there's probably, out of an abundance of caution, I think that's really helped us to minimize any impacts from the virus at this time.
No, that's great. And kudos to you guys, and hopefully you can keep that going. And Wesley, I'll bring you back in and ask the question that where we've gotten to now, when we even started talking about this webinar and trying to organize the panelists and get people involved. I don't know if we were very far past Memorial Day. And so the kind of the second wave, as some people are talking about it, that has occurred with an increase in cases in the state of Texas and some other areas from possible exposures due to people getting out over Memorial Day weekend or from other areas. Has that altered anything that you've been doing? Has that changed the way that you guys are going about things? Or has that maybe just made you say, look, we've got to stick to a time frame where we are continuing to put these practices in place longer than maybe we had originally projected? Wesley, what's going on in y'all's world in that area?
Right. So great question. When we originally designed our pandemic response team, or maybe I should say rewrote and reworked our pandemic response, a lot of times on the news we were seeing maybe some arbitrary dates we're going to shut down for X amount of days. But when we looked at that, we really didn't feel like that was the best approach to this. So our pandemic response is a phased-in approach. So depending on the transmission rates, rate of disease spread that are in each of these geographic regions, we base our response on that. So currently, I know that some of the states, Texas, Oklahoma, have opened back up and have lessened a lot of the restrictions. We really haven't done that, just because we're still seeing that fairly high rate of spread in these areas, at least not enough so that we would feel comfortable dropping that back down. And to kind of echo what Paul stated as well, and that may be part of the reason why we have been successful, knock on wood, of preventing any transmissions in our workplace, was our executive team, our general manager has been really strong about protecting the employees and making sure that their health and safety is on the forefront. So we have not dropped those back. And I think for the foreseeable future, we're still going to have some degree of response or actions in place and I really don't expect to see a significant decrease in our actions until a vaccine is is developed relatively across the country.
Paul, what about you? Is that kind of the same approach you guys are taking, that nothing's really changed because you guys were already at a heightened level and you're just going to keep that until, as Wesley said, maybe until there's a vaccine available?
Yeah, we set up phases in our pandemic response or business continuity planning, and it's certainly informed by CDC primarily, but you got to keep a close eye on to what's going on locally, to your point. So we've seen right now, that's right, we're continuing to close offices for periods of time and reopen them, and just trying to be as responsive as we can. But certainly I agree that I don't anticipate us changing it until we feel more secure about a vaccine or treatments down the road.
Okay, and Paul, and then Wesley, I want you to chime in on this one as well. As we're getting towards the end of this webinar, we told everybody it was going to be 30 minutes. We got started a little bit late, but we want to respect everybody's time and not have it go over too much. We've talked a lot about the way that your two companies have gone about it. If there's companies out there trying to develop their plan, trying to maybe alter their plan based on maybe some of the recommendations that they've heard from you or from other companies, are there specific sources that you guys would recommend going to try to get that information that are available to people?
Boy, I tell you, there is a lot available. I reference CDC and OSHA both have plans that we actually were informed. We were informing our plans by. So that would be the place to start. The health department also, state of Texas has a really good one. They have resources available. So those would be, I'd be focusing more on those government entities at this point.
So CDC, OSHA, Texas Department of Public Health.
Yeah, and NIOSH is in there as well. But they're all connected together once you start looking. It's all interrelated. They've done a nice job from that standpoint. But yeah, there's a lot of good information out there publicly available.
Good. Wesley, is that what you guys have found as well?
Right. I would echo the same thing that Paul mentioned, and maybe add a couple of extra. The majority of our information and what we built our plans on was from the CDC. A couple of additional resources for you. API, American Petroleum Institute, has a pandemic response plan template that is available. That is really good. And also our neighbors to the north, WorkSafe BC out of Canada, has a number of really good pandemic response type documents that is freely available online.
That's good. That's good to know that there's information out there. And PBPA has tried to link that kind of information on our website. We've set up a COVID-19 specific section on our website to try to get information out to people, largely on updates. We know that information changes so quickly, so it's more links to somebody, CDC's, Texas Department of Health websites, so that people can go there and get the newly updated information. But we're always looking to try to add information to that. So I'm going to look into the information from the Canada organization to see if we can link that as well. I think that's another great resource, and we're always trying to make that stuff available. As we're wrapping up here, one question that I'm going to throw out there to see is not really how you guys have responded and what kind of results you've had, but is there, as out of the blue as this was anyway for us all to deal with, Wesley, you had even admitted that your company did have a pandemic response policy, and there's probably a lot of companies out there that did. But what has really come about because of this that was just so far unseen? Something that even maybe it's a response that you've had from your employees, maybe it's in trying to implement the policies in the first place, but is there anything out there that's just been a story that's kind of stuck with you that has really helped to maybe even define this pandemic for you?
Yeah, so one of the things that has become evident, and we did have some elements of a response plan in place, They weren't active or kept up to date, so we need to do a better job of that. But some of our supplies that are critical for a pandemic response, we realized the supply chain wasn't able to hold up. The mask issue, pretty much all respiratory PPE became very limited. Even the respirators that we use for protection from silica out on a fracturing job, all those lines were turned into making N95 respirators for the healthcare community. So we luckily had a decent stockpile, but not enough. Thermometers, which is very important on the temperature screenings, were virtually impossible to get a hold of. So adjusting our emergency response plans at each of our facilities is high on the list as we move forward for us.
And Paul, what about with you? Anything that's a specific takeaway or something that was more of a shock to you going through this than you thought it would be?
Oh, yeah. You asked that question. I was thinking, man, the whole thing was a shock to the system.
Yeah.
Responding. It is, I think, the biggest takeaway, I think the biggest impact to the entire industry is going to be just remote working and how we've learned to do that. Even today, when you go on the roads, you just don't see as many people. Now, in the oil field and in the field itself, that's still going to change because day-to-day work. But just thinking about, all the support services and the office work that's going on, I think there's going to be a new way of doing business. And I think back to the earlier comments that were made, I mean, our IT systems now, we didn't know how robust they were for working remotely. And they were stress tested, and you know what? We've made a few changes overall, but overall it's been working pretty good. So some things went really well, and then some things we've just been struggling with, just as we've been going. But it's certainly, you can never do enough planning. I'll say that, leave you with that, is that the more, it's always the hardest thing to do is spend time planning, because when there's not an emergency going on, but that's when you benefit the most from it.
Absolutely. And that's I think the big takeaway for everybody is that we live in this world, in the HSE world, that you are always trying to prepare. And you don't always even know what you're trying to prepare for. And so that can make it difficult, as Wesley was saying, with knowing what supplies you need and what supply chains are going to be impacted. So trying to make adjustments, we'll make as many adjustments as an industry as we can because of this, to be prepared for whatever's next. But I'm sure whatever comes next, we won't fully be prepared, because you can't. You can be as prepared as possible. But thankfully, we've got professionals like both of you in our industry and so many others out there that have worked issues like this and similar to this and different than this, that have helped influence the way that we all can respond, whether it's in our offices or at home, to be able to not only help keep ourselves and our families safe and healthy, but to be able to keep our economy still running and be able to respond when we're called upon, when the world does get back to work. So I greatly appreciate that from you, Paul, and Wesley, and so many people out there that have been doing that type of work. To help make sure that we can respond when we're called to. Thank you both for participating in this webinar today. Thank you to our partners with OTA for helping to put this on. For those that attended as well, thank you. Hopefully you appreciated it and enjoyed it and got something out of it that you can take back to your offices to try to improve your plans. Maybe it has you asking some questions about what you're doing and how you can do it better. Thank you for coming today. Please keep an eye out for future webinars that will be hosted. We're going to try to hold one each Wednesday around the same time, if not the exact same time, on different topics. It was mentioned earlier in this one about the impact on equipment for healthcare. Well, in 2 weeks, on July 1st, we're going to be holding a panel to talk about the impacts to healthcare, and specifically rural healthcare, the type of healthcare that we have out here in the Permian Basin. We've also got another event next week where we're going to be talking about more of the financial side of things. So if that's your interest, great. And if you have any recommendations on something you'd like to hear about, something that you'd be interested in learning more about, please reach out to Grant or to me and let us know that. We want this to be a service to our membership, to the members of the oil and gas industry, in specifically the Permian Basin, but in any part of the United States that could benefit from getting this information. Thank you again for all attending today. We look forward to being able to have a meeting with you in person, maybe sometime in the future. Maybe not too near in the future, but sometime in the future. Thank you again, Paul and Wesley, and everybody have a great day.